most of you guys that were at the summit yesterday saw part of this. You didn't get to see the video, which I'm hoping is going to work at the end of this one, but if not, I'll pull it up on another way to get that, one of the two videos that we put together. Since they've gone through the bio, I'm going to skip that part. At ADOSH, we broke our state emphasis program up into basically four parts. We, of course, when the federal OSHA came out with the federal emphasis program, Arizona adopted it, and we initiated through the governor's office our own state emphasis program, which is just basically a mimic of the federal program. If you're not really sure how those programs work, usually the feds will come out with an emphasis program. We've got emphasis programs on scaffolding, excavations, warehousing and distribution centers, which was the one before this one. And we typically adopt those same emphasis programs until at some point in time, the feds decide to turn it into a standard. Last word we got, this is not going to happen anytime soon, unless there has been a big increase in, say, fatalities throughout the United States, various states. And then the president will say, they'll go to Fed OSHA and say, what are you doing about this? And they apparently already have stuff put together. It'll go through the public review program, and then it'll be adopted. And once it's adopted, then we'll adopt it as a standard. We do new program inspections, which are the state emphasis program requires that every company has a written heat program. It goes over all the elements that's covered in the federal program. We've been going out the last year and a half and doing inspections. We do, what data we collect is basically just what we're required to do from the feds on that. We have instituted outreach programs to the public, industries, and we've done that through two of the videos that we put together. In the past year, we've sent our compliance officers out to do inspections, primarily on basically complaints. Somebody will call in and says, well, this place is too hot to work in or something like that. So we go out there. Not all of the complaints turn out to be valid complaints, but we do investigate them. We have two ways we can do it. We can send a compliance officer out to do an inspection, or we can, depending on what the complaint states, we'll send a letter out to them, informing them that they are required to comply with the state emphasis program on heat in the workplace, and we want to know what they're doing to comply with that. We do new program inspections with every organization we go out and do inspections on. And the heat months, which has been here in the past March through just recently, when we go out, that's one of the first questions they will ask them. Do you have a heat program? And if so, we need to see a copy of it, and we verify whether it's in compliance with the federal standard and the state emphasis program. We've collected some data. Again, we don't have a enforcement standard where we can enforce something if there is a problem, but we do identify any problematic issues that companies have when we go out. Now, one way that we can enforce the standard, since it's an emphasis program, it's not a federal standard, then we would file what we call a general duty clause violation, which the standard or the issues have to meet the same thing as a serious violation. Or if it's a company that's just willfully, they've been aware of it, they haven't done anything about it, then we could potentially file a willful violation, which from that standpoint, from a penalty standpoint, a serious violation would be $16,550 with a minimum penalty of $12,000 $200. A failure to abate, which shouldn't be an issue for any reason. The willful or repeated violation, but willful violation would be the one we would get right now because there is no such thing as a repeated violation at this point. That's $165,514. So quite a lot of money, which could happen. Now, in our inspections, when we go out from my group, which is consultation and education, we go out, and that's the very first things that we do. When we enter into a agreement with a company to go out and do a consultation visit, we ask to see all their programs. This program would be one that we would want to see if they have one, what it consists of. If some companies call us and say, hey, we don't know just what we've got to do, we have sample programs that we can send them. It's actually the program that the state of Oregon put together. We did a lot of research. Rather than trying to reinvent the wheel, we basically decided on this is one that kind of meets the requirements, and we're going to go with it. So that's what we've done. From a compliance standpoint, in 2025, fiscal year 2025, which is for us is from July 2024 through June 25, we did 21 heat-related inspections. There were 0 citations issued. And again, if we did cite a company, it would be under the Arizona Revised Statute, Article 1023-403, which is the employer general duty clause. We haven't sent out any hazard alert letters or abatement letters in that time period. From our consultation and outreach training services, we've done 373 heat and safety health visits. In the outreach training part of it, we did 102 webinars, 110 in-person training classes during that time period. As far as, and of course, our management goes out and they do also training with organizations when they go meet with a company or meet with an organization. We do that type of presentations. From an outreach training standpoint, in 2025, we conducted 3,096 management and non-management employees across the state of Arizona. We trained them. And in that case, I trained them because we don't have another trainer. In June of 2025, we put together 2 videos, one in English and one in Spanish, on the requirements of the state emphasis program on heat in the workplace. I've actually been tasked that for 2 years, and I kept telling them, give me a program to do it with. I can't do it, pull it out of thin air. So they finally came up with a way of doing it, and we put it together. We both have the English and Spanish. They're on the ICA website as well as the ADOSH website. So here again, from a compliance standpoint, the completed 21 inspections again, with program reviews with all state emphasis programs on heat stress. Now, this is where we didn't get to see yesterday. So hopefully this will play here. If not, I will pull it up another way.
Welcome to Arizona's commitment to workplace heat safety. Good morning. As we all know, working in Arizona comes with its unique challenges, and perhaps none is more prevalent than the heat. Today, we're here to talk about something crucial for every employer and employee across our great state: the Arizona State Emphasis Program to combat heat illness and injury in the workplace. Our goal is to ensure that everyone understands this vital program, why it's so important, and how we can all work together to create safer, cooler workplaces. Living and working in Arizona means confronting extreme heat, especially during our long summer months. But this isn't just about discomfort. It's about a hidden danger. Heat illness is entirely preventable, yet tragically, it can be fatal. To effectively prevent heat illness, we must first understand heat illness isn't just one condition. It's a spectrum, ranging from heat rash to the life-threatening heat stroke. The causes are often a combination of factors: high temperatures, humidity, physical exertion, dehydration, and even medications or pre-existing health conditions. It's crucial for everyone to recognize the symptoms. For heat exhaustion, look for heavy sweating, nausea, and dizziness. But for heat stroke, which is a medical emergency, warning signs include confusion, hot, dry skin, or profuse sweating, and a body temperature over 104 degrees Fahrenheit. If you suspect heat stroke, call 911 immediately and begin active cooling measures. For less severe conditions, move the person to a cool area, loosen clothing, and encourage hydration. The Arizona State Emphasis Program is a proactive initiative designed specifically to combat heat-related injuries and illnesses in our workplaces. It focuses on those industries and occupations where the risk is highest, whether it's outdoor work or strenuous activity in hot indoor environments. The program is built upon 5 critical pillars, forming a comprehensive and proactive approach to heat safety. The first 2 pillars are the foundation of our safety efforts. Firstly, comprehensive training for both workers and supervisors is recommended. Everyone needs to know how to recognize the signs and symptoms of heat illness in themselves and their colleagues, and what immediate first aid to provide. Workers must understand prevention strategies like proper hydration and rest, and feel empowered to report any symptoms. Supervisors play a critical role in enforcing controls and responding to emergencies. Secondly, we must diligently monitor the weather and workplace conditions. This means checking daily forecasts, understanding the heat index, and, ideally, using tools like wet bulb globe temperature devices to assess real-time conditions. This allows us to adjust work schedules and break times proactively. Once we understand the risks, we can effectively mitigate them. This leads us to the third and fourth pillars. Conducting a thorough heat hazard assessment means identifying all heat sources, evaluating the intensity of the work, and considering environmental factors like air movement and radiant heat. We also must account for individual worker risk factors to determine the overall risk for specific tasks. Based on this assessment, we then implement appropriate prevention strategies and controls. These can be engineering controls like improved ventilation or shaded work areas, administrative controls such as structured work/rest cycles and mandatory hydration breaks, and finally, providing appropriate personal protective equipment like light, breathable clothing and cooling vests. Even with the best prevention, emergencies can happen. That's why the fifth pillar, planning for heat-related medical emergencies, is critical. Every workplace needs a clear, communicated emergency response plan. This includes knowing who to contact, ensuring trained personnel are available, and having immediate access to emergency services. Stocking cooling supplies like ice and wet towels is essential for rapid response. We must also regularly practice and review these emergency procedures. Remember, in cases of severe heat illness like heat stroke, rapid response can mean the difference between life and death. Beyond monitoring the environment, a truly forward-thinking approach involves physiological monitoring. This is about understanding how the individual worker's body responds to heat stress. While not always mandatory, using tools like wearable technology to track core body temperature or heart rate, or even implementing simple hydration checks, can provide invaluable early warnings of heat strain. This allows for personalized work/rest cycles and proactive intervention before symptoms even appear. It's a data-driven approach that enhances worker safety and provides a deeper understanding of individual tolerance, leading to more effective heat management strategies. Now, let's bring it all together. The principles we've discussed today aren't theoretical. They need to be applied directly to your workplace. This involves systematic heat hazard evaluation. You'll identify high-risk tasks, assess the environmental conditions, evaluate the physical demands of the work, and consider individual worker factors. From this, you'll determine the specific risk level and then recommend targeted controls, whether it's installing shade, adjusting work schedules, or providing cooling vests. Remember, this isn't a one-size-fits-all solution. Your plan must be customized to your unique workplace, and it must be regularly reviewed and updated as conditions change. Ultimately, the Arizona State Emphasis Program is about more than just compliance. It's about fostering a deep-rooted culture of safety in every workplace. The benefits are clear: a healthier, more productive workforce, reduced operational costs, and an enhanced reputation as an employer who prioritizes their people. Every single employer and employee have a crucial role to play in the success of this program. I urge you to utilize the resources available from organizations like Arizona Division of Occupational Safety and Health, OSHA, and the National Institute of Occupational Safety and Health to further your understanding and implement these vital practices. Together, we can build a cooler, safer, and more resilient Arizona for everyone. For more information, please contact Arizona Division of Occupational Safety and Health Outreach Training at Phoenix Office 6025-4214, 60 Tucson Office 5203-2042. Thank you.
Now we we have that same video in Spanish that we put together, and we encourage everyone to go out and use those for their tailgate safety meetings or any meeting they occur that they have with their employees during the heat months. In the video, they talked about the heat index. We also encourage everyone to download from the CDC website the heat index. It's free downloading it. I'm trying to pull it up right now. Currently, and I showed this yesterday at the summit, that's what we are. We're in the caution range, 62 degrees Fahrenheit, ambient temperature 63, 58% relative humidity. This has a lot of information. You can go check it from a time period from like 8 o'clock in the morning all the way through the afternoon, whatever. Typically in my training classes, I start out the class and I show this at what the temperature and humidity is at the time that we're doing the classes. And at the end of it, I'll pull it back up and show what the difference is. And especially during the months of May, June, July, August, and in September, and in the early parts of October, we were in the danger zone at 9 o'clock in the morning, just about every morning. So that's part of our training that we do every class, except I stopped doing it when it started cooling off a little bit, but we'll pick it back up in when the temperature started to rise and we start seeing it getting in the danger zone or caution zones. We'll start doing those briefings every time we do a class. That's what we've done as far as complying with the federal standard and implementing the state emphasis program. Does anyone have any questions?
Thank you so much, Art. We do have a question in the chat, which is from Priyanka, and I think it was from earlier in the presentation where she asked, I'm curious if those referrals are connected to healthcare or other entities to support worker recovery and further prevention. And I think what she's referring to as far as the referrals is either for looking into, circumstances or violations, perhaps.
Typically, the complaint system, the way it's set up, any employee in the state of Arizona, regardless of where they're working, construction, manufacturing, general industry, hospitals, restaurants, whatever, they have the right under the OSHA Act to file a complaint with ADOSH or federal OSHA. If they work for the military or if they work for post office, of course, the Indian tribes, we don't have authority on. Military reservations, we don't have authority on. And the post office, we don't have any authority. That's done by the feds. And so, but they can file that complaint. Even if they file the complaint with us, then we would, depending on what it was, who it's about or with, then we would turn it over to the feds if it was their complaint. But we do address those. They can either be addressed by sending a compliance officer out on an inspection or through a letter. We don't handle complaints in consultation and education, and our compliance assistance group don't handle complaints. We leave that strictly up to the compliance side of the house, simply because we don't issue citations. When we do our inspections, work with contractors like I do, and the compliance assistance group is, we'll write, if we do any type of inspection and there are violations, we'll write what we call a hazard report. That has the same validity as a penalty, but there's no penalty from us. They have to agree to correct the problem within a certain period of time. Generally, we give them 30 days. Compliance may only give them 3 days or 1 day. Just depends on what the situation is. So it's a little bit different between the two sections of the two groups. But we do address every complaint that we get. And here again, it's done through our compliance group. That's why in the presentation, at the current time, they have not issued any letters. Those letters are something that's spelled out in the federal program that they can issue a letter to the company, basically telling them there's been a complaint, there's been a violation. What are you planning on doing to correct it? They've just kind of figured that part of the process out. They had to write what we call an STP to do it, and it took them a while to come around and getting that done.
So so the complaint process is essentially they would call you or ADOSH and provide that complaint. There's not an app or some kind of online.
They can actually go online and
Okay.
fill a complaint form out online. They
Okay.
can do it anonymous, or they can give us their name.
I see.
Typically, if we go out on a complaint, even if they've, unless they say, we don't care if you give them our name, we redact all that information. So the employer would not, they would only know that that a complaint's been filed against their organization. And here again, when I was a compliance officer, I actually did one complaint. I didn't know who filed the complaint because I'm the one that redacted the paperwork. But the manager of the facility, he actually told me when I sat down to start talking with him, he knew who filed the complaint. I didn't admit I knew, but here again, right in the middle of our conversation, his secretary came in and handed a folder to him, which that folder was a directive from their corporate headquarters out of Chicago saying, deny entry for any compliance officer. So I confirmed that he was denying entry. I said, you realize I'm coming back with a warrant, and it's not going to be just about the complaint now. It will be a comprehensive inspection of your facility. His hands were tied, and he admitted we try to talk him out of it, but some cases we get those situations where corporate headquarters has said, do not allow ADOSH or OSHA in their work site for any reason. Sometimes they'll say, well, if we have to get our lawyer there, well, we'll say, that's fine. You got 1 hour. At 1 hour, we're going to do the inspection.
So Priyanka was wondering if the information that you collect gets connected and shared with the care side. So I'm assuming with the medical profession, those that might be, I guess, handling some of those help cases.
To my knowledge, it's public record, but we do not go out of our way, to my knowledge, to share that information with anyone.
Okay.
It's, public knowledge. They can request whatever they call it and get that information, but it's something we don't basically share with the public.
Sure. Okay. Gretchen has in the chat, she's wondering if you're aware of current activities related to Arizona updating the worker heat standards and incorporating enforcement. If so, could you share more about that?
At this point in time, until it becomes a federal standard, all we can do is basically what we do right now, do inspections. We can file a general duty clause violation because there's no federal standard. If the feds had a specific standard like we have on fall protection or scaffolding or excavations, then we would have more authority to go in and do these inspections. But right now, it's not. Even the warehouse and distribution systems national emphasis program, we do inspections and we talk about heat there because that's considered in those areas, but there's no specific, unless they've had a violation on forklift training or something like that in these warehouse and distribution centers. We would only be able to address it through a general duty clause violation.
Okay. Thank you. And Gretchen, I hope that answers your question. Mary has in the chat, what is the general attitude of contractors? Is there typically a lot of pushback like that story, or is that more the exception?
Actually, the contractors, once the federal program come out, because everybody got wind of it, their corporate safety people got wind of it and all like that. They're real. They basically go out and have put up cooling tents, swamp coolers in them, fans, ventilation systems and stuff. They put the refrigerators and stuff where people can get cool water, tables and stuff where they can sit down and rest and stuff. And they adopted the process. It's better to make sure the employee is taken care of than have somebody go down with a heat exhaustion or heat stroke. The standard says heat stroke is a medical emergency, but we consider heat exhaustion also a medical emergency. I did a training class for the Circle K Corporation. They're people that go out and service their HVAC systems, their refrigeration units and all that. And their policy was, they had a program, but their policy was that if the employee started experiencing symptoms of heat exhaustion or heat stroke, was to call their supervisor, and their supervisor would then call them back every 30 minutes. I basically said that would be a complete violation of the standard or the state emphasis program, that any heat exhaustion criteria or a heat stroke is call your supervisor, tell them, then call 911. We've had 2 cases that I'm aware of where we had a person servicing an HVAC system on top of a building. They were in communications with their family for some reason or another. They lost contact. The family called the police, the fire. Apparently the individual had a heart attack on top of the building. That was nothing said it was related to the heat. We did have a case up in Prescott, Chino Valley, the Prescott area, where a HVAC technician was up inside an attic working on a unit, came out, took a swig of water, and then passed out and fell and hit his head on concrete. That again may be related to heat, but the fatality was basically where he hit his head as a result of it. So it's different. I've been told by the compliance supervisor down in Tucson that they talked to the Pima medical examiner, and I don't know whether this is true or not. It's just hearsay on my part, but they said that the medical examiner determines whether it's a heat-related death by, I guess, the temperature of the liver. I don't know. I haven't talked to anyone, here. Maricopa coroner's office is down the street, but we haven't gone over and talked to them for anything.
Interesting. So are you aware of businesses or an employer that's been sued because of like heat death or not providing such, heat related prevention?
I haven't heard anything about it.
Okay.
Typically, if things go to commission, if something like that would go to commission and they cite a company about it, then I hear about it. But the normal day-to-day visits that the compliance officers make, unless it's related to a fatality, trenching operation or something that's a national emphasis program, I don't normally hear about it right away. Sometimes I hear about it secondhand, and I'll start asking questions of what's going on. Usually it's when it goes to commission is when I hear about a company's been cited for a specific violation of the OSHA standards. And we haven't had anything go to commission heat related.
Okay. And can you remind everyone as far as like which businesses are under the oversight of ADOSH, just so everybody has that kind of baseline information.
Well, like I said earlier, we don't have the manpower. I mentioned that yesterday in the summit, that we just don't do random inspections. Now, back in the day when I was a compliance officer, we had one supervisor, 11 compliance officers, and we set our own schedule. We did our own inspections. We were not directed to do inspections like they do here. And here again, it's the simple fact is we have a limited number of people from a manpower standpoint.
I guess, well, what I was getting at was, does ADOSH oversee all businesses, all different types of businesses, or are there some that are exempt from that type of oversight or outreach?
Well, actually, from an outreach standpoint, we have contact with all businesses. When we're doing the OSHA 300 logs, there are certain businesses that are high hazard operations, which we do. That's where we'll spend a lot of our time doing inspections. There are some industries, like a doctor's office is exempt from keeping an OSHA 300 log. We don't have a lot of industries and stuff that has a lot of injuries and stuff like that. We get reports from the Bureau of Labor Statistics on that. High mod areas, from an insurance standpoint, workman's comp, we do stuff like that. But it depends. Again, most of the stuff is done is either by a complaint, or the company calls up and asks for a consultation visit, or we get information from the Bureau of Labor Statistics on high mod areas, anywhere where they've got a lot of workman's comp cost, workman's comp claims. We had a big thing here about 2 years ago with the fire departments, not the municipal departments, but the outlying volunteer fire departments. A lot of injuries, and we had to go do a bunch of training as well as send people out to do that. If we go out and do an inspection and they have a high EMOD rate, then we spend a lot more time with them going over what they need to do in compliance as far as reducing those injuries.
Okay. I see Gretchen has a question in the chat. Gretchen, do you want to ask that question? I think we can take that and maybe another one, and then we can kind of wrap up.
Yeah, it was just kind of a follow-up on my first one, because I believe that there is a workplace heat safety task force that the governor's office has put together. Though I'm no expert in this. It's just that is my understanding that there is one, and I'm wondering if one, you're familiar with that, and two, regardless if the governor were to implement something, whether that would if the task force were to come up with a concrete recommendation, whether that would be implemented through your office or some other way.
Number one, as far as the governor established the workplace heat task force. I was asked by the director of the ICA to represent ADOSH and the ICA on that, working with Dr. Levine and his group. The other part of it is that it's highly unlikely the governor has enough clout that she could implement a standard. It's not unlikely, but it's highly unlikely that she would do anything without some form of guidance coming down from the federal government.
Okay. Thank you. Any other questions for Art before we transition? So Art, is the training video, or the video that you showed, is that available online?
Yes, ma'am.
Okay, so we
You can go to the azica.gov, which is the Industrial Commission website. And when that comes up, the second ribbon down is on heat. You click on that little icon in the middle, it'll pop up and it's in the second column, and it lists the English version and then the Spanish version videos. It's also on the ADOSH website too.
Great. Okay, we can make sure to include that as a follow-up so folks have access to that. And okay, if I share your contact information, if they have questions following the presentation, they can get a hold of you directly.
They can get a hold of me directly. The cover slide has my email address as well as my phone number on it. I'm usually here all the time. Most of the time I am training, doing sometime, usually between 8:30 in the morning and 11:30 on Tuesdays and Thursdays. Tuesday through Thursday, I'm doing either in-person training or webinar training. Mondays and Fridays, I'm sometimes out in the field doing training with a company that requests training. I'll be in Prescott all day tomorrow doing training with the city of Prescott. So.
Great. So then you also provide those services to municipal organizations. So for some of our communities that are on the call, they can take advantage of the trainings as well.
All of our training, all of our consultation services are free of charge. You just have to make a request, and then we assess the request to determine, what's needed. And like right now, our consultation group, they're 2 months out. If you requested a visit today, it'd be 2 months before they're going to get around to you.
Okay.
So busy they are. I'm booked through the end of the year. The new training schedule for the third quarter, which is January 26th through March 26th, will be on the ICA website and the ADOSH website by probably, I won't say the end of this month because my admin is going out on vacation and so am I. So probably sometime in by mid-December that will be out there published.
Great. Wonderful. Well, thank you so much for sharing your expertise. I'm really glad we were able to get the video to work, and also that we transitioned over to the Google Meet. So thank you so much for sharing your information with us today. Really appreciate it.